HomeoeGuru. Please subscribe our channel, press bell icon to get continuous updates about new videos. Topic based video part 23, Yellow Fever. Yellow fever that is caused by group B arbovirus, genus Flavivirus. It is a zoonotic disease transmitted by Aedes mosquito. Incubation period 3 to 6 days. Yellow fever is an acute hemorrhagic fever due to infection from viruses of the family Flaviviridae, single-stranded RNA virus. Pathology. In liver, acute midzonal necrosis occur that will lead to deposit of councilman bodies and torus bodies. Clinical features 3 stages. First stage or period of infection. It lasts for 3 days. Symptoms fever, headache, myalgia, nausea, vomiting, relative bradycardia. Second stage or period of remission. Third stage or period of intoxication. Symptoms high fever, body pain, hemorrhage, organ dysfunction, jaundice, finally death. Diagnosis detection of IgM antibody by ELISA test. Prevention live attenuated vaccine 17D strain. Thank you.